الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Planning Health Services Professor Mahmoud Hani Sulaiman. A plan or policy is authoritative written statement of intent to aim for certain goals, to make organizational changes, or to commit resources to particular types of activity. Again, a plan or policy is authoritative written statement of intent to aim for certain goals, aim to make organizational changes, aim to commit resources to particular types of activity. Again, a plan or policy is authoritative written statement of intent to aim for certain goals, to make organizational changes, or to commit resources to particular types of activity. Such plans may include details of how these commitments are to be done. Planning of health services is process of developing and disseminating such plans or policy. Planning processes usually imply a rational approach to policy making whereby each stage of planning process feeds into the next. These steps are problem description, leads to formulation of goals and objectives, lead to a specification of alternative, then choosing amongst these alternatives, problem description, then formulation of goals and objectives, then a specification of alternative, then choosing amongst alternatives. Many descriptions of planning process also include essential stages of implementation and evaluation. Given that evaluation stimulates reassessment of original problem and a judgment about success of current plan, outline process can be defined as planning cycle. The figure is in next slide. Once population need for health care understood and evidence assembled of what effective interventions are for that particular need, then planners can ensure services have the right workforce, provide effective interventions, are in right place, and have capacity to cope with expected workload. At least that is the theory, but in practice, many other considerations may influence outcome of planning. Changing services to meet need takes time. Any plan takes time. Public and political views on provision of health care may not match the public health view. This is the planning cycle. It begins as the arrow indicates by defining the problem, then developing and analyzing alternatives, presenting recommendations to decision makers, then deliver of service, then evaluation of what is going on, then the strategic phase where we decide about if we continue or to make some changes. Equity. Public health is concerned with meeting health needs of whole population. Needs of whole population, not just those who are most able to reach or use services. When planning health services, so explicit consideration must be given to ensuring that everyone, this is the meaning of equity, everyone who can benefit from a proposed service is able to receive it and able to reach it. It is recognized that those most in need of health care are least likely to receive it. This inverse care law, first put by Julian Theodore Hart, AGP in South Wales. For this reason, health services should be regularly monitored to ensure that they are equitably provided. Equity continued. Figure next slide shows principle of health equity audit, which compares need for health care with use of a health service or intervention. In case of revascularization described, mortality rates from coronary heart disease were used as a measure of need, and revascularization as a measure of health service use. For a service to be equitable, expected relationship would be to note that the higher the mortality rate in a population group, the higher the revascularization rate in the same group. But in the example quoted, this was not the case, suggesting an inequitable service provision. This is the figure about health equity audit. Please print it and read it carefully. Print it and read it carefully. It describes what we have said in previous slide. Types of health service planning. Health service planning can occur at many different levels and can differ in terms of how plans are developed. Plans may be national, regional, local, hospital-based, or even a plan for your private clinic. Any health plan can be national, regional, local, hospital-based, or even at your private clinic. A strategic plan mainly broad goals. Operational plans specify specifics of organizational relationships and how to use resources. Strategic plan, broad goals, operational, evidence-based or political in terms of process of their development. Some plans may be for workforce planning and bed planning. Needs and evidence-based planning. Health services developed through increment in increase in resources. Incremental increase in resources, i.e. existing services expanded by an amount each year. Political concerns and local vested interests led health services to develop differently in different local areas. While there were good reasons for initial establishment of these services, over time changes in population and disease lead to that these services not meet requirements of people. Health planning is based on assessing population need for a service. Needs assessment methods must be considered in evidence of effectiveness of services and needs assessment. Target and monitoring. Targets are numerical policy goals and feature in plans related to health. Examples of target include child immunization, reduction in road accident deaths, screening for different population among different populations. Some targets relate to health outcomes but may focus on process measures as waiting times for treatment among patients. Targets and monitoring. Clearly, to be effective, targets need to be monitored and also need a date by which target should be met. Targets need to be realistic, yet also not be so easily achievable. Realistic, achievable, that they will not stimulate greater effort and innovation related to they must be related to ultimate goal of policy. Ultimately, incentive for meeting targets depends upon possible rewards and time frame. Possible rewards and time frame. This is an example of setting targets, setting smoking cessation target. Say in 2002, MOH set a national target for smoking cessation to decrease prevalence of smoking by 800,000 smokers during the period 2003 to 2007. Target measured as smokers who successfully quit smoking for 4 weeks and it to be achieved over 3 years. Each local area received an allocation from 800,000 equal to their contribution to achieve national target, with intermediate target set to ensure they were making progress. وفي النهاية أقول الحمد لله رب العالمين و thank you for your good listening.